All right, guys, welcome back to another article breakdown. Today we're talking about dry needling and the combination of dry needling and manual therapy in combat athletes who have neck pain, specifically acute neck pain. It was published in the Journal of Sports Science and Medicine, and then it's cited below, and as always, it's going to be linked in the description so that you can follow along as we go through. Okay, so the introduction of this article starts off by highlighting some of the previous research on manual therapy methods that specifically in acute pain have been used in the physical therapy world. It also cites some of the meta-analyses and systematic reviews that have been done looking at trigger point dry needling specifically. There are different types of methods of dry needling, so that's a little bit contentious in the PT world, specifically those who do dry needling, but related to acute neck pain. And then, of course, the entire reason of the study was to look at the effects of combination of manual therapy and dry needling with just manual therapy alone on acute neck pain, specifically in trigger points in the upper trap. All right, so let's get down to the methods. This was a single blinded study, which means that the participants were blinded, but the clinicians were not. It would be impossible to blind the clinicians to the treatments that they were given. And it was a randomized control trial designed with 30 combat athletes. MMA, judo, and BJJ were represented in the study. And so they divided it into two groups. The MTDN is manual therapy dry needling, and then the control group, which is, if you're looking in the article and following along, it would be denoted by the letter CG. So as you would imagine, the manual therapy and dry needling group received manual therapy and dry needling. And then the control group received manual therapy in the form of ischemic compression, which is just essentially pushing on either if you've identified a taut band of muscle or a trigger point in the muscle, holding pressure on that particular part of the muscle and then waiting for it to relax and then letting it rest and repeating it. And they give the exact outlines in the study. And then the sham dry needling technique is essentially just using a needle that is designed specifically for this to give the illusion that you're inserting the needle into the skin and the muscle, but you're actually not. And that has been validated in another study that they cited in the literature if you want to go check that out. So a continuation of the methods, all of the measurements at the beginning were taken one day after the last training session. So everybody who was in this study, the last day of their training session, the measurements were taken one day after to start. So after the initial measurement, they did one session, then 72 hours after that session, they would take measurements again and then perform the next session. So they measured things like muscle tone, pain pressure threshold, isometric strength, and then range of motion. We're not going to go through how they did all of those. You can read the literature, or if you subscribe to the Patreon, we'll end up talking about this in the later section. So if you want to dive deeper, consider subscribing to the Patreon for a longer version of the breakdown. All right, so now let's look at some of the results. All right, so there were some statistically significant differences between groups here, and it favored the manual therapy with dry needling for muscle tone and pain pressure threshold, but not for isometric strength or range of motion. And this means whatever ways that they were used for pain pressure threshold, I'll go ahead and tell you the pain pressure threshold is a device that measures how much pressure you're putting over the area that's painful, and then once it reaches a certain level, that's where they say, okay, that's the threshold that somebody is reporting pain based off of the amount of pressure. Then they record the pressure, and then that is their pain pressure threshold. They measured to see if it went up or down after all of those, after manual therapy, dry needling, and then also after just manual therapy. It was better in the manual therapy with dry needling versus muscle tone, versus the control group. And then muscle tone was measured a different way, a little bit more unique. I'm not as familiar with that method, but you can read about it in the article. And these differences were found mainly after the third session, okay, and after the 72-hour follow-up. So they had a couple of sessions, they've had 3 sessions, and then the 72-hour follow-up after the third session was when they saw the most results. So it didn't really start to pan out until after probably a week and a half to 2 weeks. Now, the discussion. We'll talk about whether manual therapy and dry needling are more beneficial in general, but according to this study and this specific population, these groups of people, and the way that they designed the study, manual therapy and dry needling may have been more beneficial to them in the short term, because this was, remember, in the beginning they talked about acute neck pain, so they had just experienced neck pain within a certain amount of time to be considered acute neck pain. Not chronic neck pain or acute on chronic neck pain, which just means that you have pain over and over again, just in the acute time frame. And it seems to be comparable to the past findings. Now, some of these findings were not necessarily in combat athletes in particular, so it's less generalizable, but it seems comparable to, and you can look at some of the citations in the study, to some of the research in the past that had looked at things similar to this. And next they talk about why the pain pressure threshold and the muscle tone may have experienced statistically significant differences in the group that did dry needling. They suggested it may be because of increased blood flow due to the area of dry needling. So when they insert the needle into the trigger point and they get this twitch response, it causes like a contraction in the muscle. It also causes an area of local inflammation. That may be why they experienced a little bit more pain relief and a little bit decreased muscle tone, at least in the way that they measured it. Some other things that they talked about was that dry needling was not expected in the first place to affect strength due to the mechanism of action, right? So this would make a little bit more sense if there was an accepted way that dry needling was proposed to work. Like the mechanism of action isn't very well understood, not to mention that there are several different ways to dry needle. The way that I dry needle is I put needles in a region and then we hook it up to electricity and the muscles are constantly twitching. And this is thought to create a neurophysiological response that results in the downregulation of muscle tone, but that's neither here nor there. This was more of a pistoning technique and a twisting technique. Who knows which one is better? I use it very sparingly, but this is what they talked about in the discussion. We'll talk about whether or not I agree with that a little bit later. The previous studies are more generalizable than just combat athletes. The reason I included this in the video was because combat athletes tend to experience a little bit more neck pain just due to the nature of the sport. So this is a little bit more unique to just combat athletes, and so it's not going to be as generalizable. And then of course pain is multifactorial, right? So that we're not just talking about tissue damage. We've learned a lot about pain in the last decade, 2 decades of research when it comes to physical therapy and allied health profession. So you should go see a licensed professional rather than having somebody stick needles in you. And this is where we end for the regular portion of the part that I'm going to put on YouTube for everybody to see. If you want to see more, we're going to go into some strengths here in just a second. You have to subscribe to the Patreon for that. But for those of you who are subscribed, I'll see you over in the Patreon. And for those who aren't, appreciate you guys watching, and I'll see you next time.